So conservatives love to argue that government is inefficient and wasteful. And there are certainly some examples that you could point to when it comes to government largesse. For example, there's a story recently about Nikki Haley's curtains, which actually, to be honest, were not actually Nikki Haley's fault. They actually existed during the Obama administration. Nonetheless, there are some examples that you could point to, like the $5,000 toilet seat, right? Toilet seat, as I like to call it. Okay, now you can point to it and you can be like, why is the government spending $5,000 on a toilet seat? Or like, a bunch of money on, donuts? It was a lot of money being spent. But here's the thing. When conservatives point that out, their solution isn't, hey, maybe we should do more oversight. Maybe we should do some better budgeting and make government more efficient. No, their solution is actually taking government assets and handing them over to private corporations. Now, that's what Iowa did in the case of Medicaid. They're like, man, we are spending a lot of money on Medicaid, on insuring poor people, so here's what we need to do. We should just sell it over to private interests. And that's what they did. Now, Medicaid normally is state-run insurance for people who cannot afford insurance on their own, people who are in poverty. Now, how did it turn out after Iowa decided to privatize its Medicaid program? Well, not so good. According to a report in the Des Moines Register, the average cost of insuring an Iowan had increased by 3 times, or at least increased 3 times as fast since the state hired private companies to manage the program when compared to the previous 6 years, according to state figures. Since fiscal 2017, the first full year of privatization, the per-member cost of Iowa's Medicaid program has risen an average of 4.4% per year, according to the Nonpartisan Legislative Services Agency. In previous 6 years, the per-member cost rose an average, and this is for comparison's sake, of only 1.5% per year. So over the past year, 4.4%. In the last 6 years, 1.5. It just so happens that the cost per person has risen 4.4% as soon as they privatized it. Fascinating. Now, the Legislative Services Agency had compiled the new cost increase figures from past budget reports published by the Department of Human Services, which oversees Medicaid. So, oops. Looks like your cost went up. Surprise. Oh, you thought privatization would save you money. Oh, it turns out that's incorrect. When you put a profit motive inside of a government service, it ends up costing more. Because guess what? Extra funding gets allocated to someone's pockets, or extra savings. Now, from day one, according to Senator Liz Mathis, she's a Hiawatha Democrat, she said, we've doubted privatization of Medicaid would save money. She said that the numbers would be hard to dispute since they come from the department's own reports. So, hey man, that's not fake news. That's your own report. Mathis also said the department has yet to offer solid data backing claims that private Medicaid managers have prevented costly health problems. They've been unable to show any data that Iowans are better off, according to the senator. Now, of course, they push back. Oh, no. That's not at all the case. It's the last year. We didn't add stuff from last year onto this year, and that's why we've had such an increase. But wait a minute. That doesn't account for the last 6 years before that, where you had a steady increase of 1.5%. Whereas as soon as you privatized it, in 1 year, it jumped up 4.4%. Now, Republican Governor Kim Reynolds said in an interview on Wednesday that she remains confident in the promise of Medicaid management that is private, despite these new cost numbers. And Reynolds said the Department of Human Services administrators have assured her part of the explanation for the recent spike in per-member Medicaid costs was bills incurred in past years were being paid in the current budget year. I'm not buying it. I am not buying that at all. I mean, maybe there is, right? And some of that cost can be attributed. But what about the profit motive? Did they even factor that in at all? Look, these companies have fiduciary responsibility to return profit to shareholders. So now, here's the thing. There is some argument that there are private entities that can reduce inefficiencies in order to make more profit, right? They streamline and they get rid of unnecessary bureaucracy, etc. And that's how they save money, right? Well, now, here's the thing. These companies, as soon as they do that, do they just leave that extra money lying around or return it to the taxpayer? No, they put it back in their own pockets. That's the whole point. You reduce inefficiencies and you reduce bureaucracy in order to save money so that you can funnel more money to your shareholders. That is the whole point of a private corporation. If you're a for-profit company and you're working for the government and you're working on a government contract and you leave money sitting on the table from the taxpayer, you're an idiot. You do not deserve to be in business in this model because you suck at it. That's the problem with private corporations. That's the problem with privatizing public goods like Medicaid. Look, and here's the other thing. Generally, Medicare and Medicaid systems run very lean. They're actually more efficient than private industry. In fact, according to the Center for Budget Policy and Priorities, Medicaid provides more comprehensive benefits than private insurance companies that significantly lower out-of-pocket costs for beneficiaries. But because of its lower payment rates to healthcare providers and lower administrative costs, the program ends up being very efficient. Now, of course, there are certain drawbacks to that, whereas there are some doctors out there that won't take Medicaid because of their lower payment rates to healthcare providers. There's a solution to that, though. Medicare for all. Medicare for all, you have one insurer, the government, and then, oh, look at that. These doctors can't refuse you. They have to take you at these lower prices. That's why we argue successfully, and studies have shown, even studies trying to debunk this, have ended up showing that's why Medicare for all saves money. And I know Medicare for all is on a federal level, whereas Medicaid is on a state level. But if you have a Medicare for all system, then those individual state Medicaid programs go away because everybody will have insurance. But anyway, now to show you how much more Medicaid, right? Or I'm sorry, how much more you could save with Medicaid, or how much states traditionally do save with Medicaid. Adults on Medicaid cost about 22% less than if they were covered by private insurance, according to the Urban Institute. 22% less. Again, these are the poorest of the poorest on the adults that qualify for Medicaid, and they cost 22% less. Now, where does that extra 22% go with private insurance? That goes into the shareholders' pockets. That's the whole point. So, look, this is the business model. That the whole point is to make profit. That's why you can't run a private insurance program through the state, funded by the state, and save money. That's why it always will cost more than having a government-sponsored program. Now, here's the thing. The Medicaid cost increase from the fiscal year are partly driven by the 8.4% raise the Iowa Department of Human Services agreed last month to get the two managed care companies running the program. That raise, which includes state and federal tax dollars, will send $344 million more to Amerigroup and United Healthcare this fiscal year, which runs through June of 2019. Oh, look at that. They sign up would have privatized these groups, Amerigroup and United Healthcare, to run the state's Medicaid system, and then had to give them extra money on top of it, $344 million more. That's where your extra cost is coming from. And where's most of that money going to go? It's going to go into shareholder profits. Now, state administrators do expect costs to drop 4.7% next fiscal year, but then climb 1.8% the following year. What they base their projections on, I have no idea. But that's what they're saying. Those projections, however, do not include any raises the state might negotiate with the managed care companies for those years, which could significantly push up taxpayer spending. This is what happens when you privatize government services. You end up spending more on the same services. It's a fact. Now, when you push privatization, you can't claim that it will save money, because it doesn't. It's been shown in nearly every circumstance that when you privatize something like a Medicaid system or like private health insurance, the costs will continue to go up higher than if you had stayed with the government option or the government plan. This is why, this explains why right now we have the highest healthcare costs in the developed world, because we have this for-profit healthcare system that is always going to cost more, because again, it's all about profit. It's all about profit. So now, of course, why do these politicians do it? Why are the people in Iowa, Republicans mostly, pushing for this? Well, follow the money, Lebowski. These corporations, they donate money to politicians, and they expect a return on investment. And this is a good example of that return. This is the return. More money in their pockets, more pay raises for their executives. What we need is a public Medicare for all system, right? Iowans are going to learn over the next few years that privatization is not the answer. It's not the cure-all for the problems of rising healthcare prices. It is actually the disease. The real cure is a federal Medicare for all system, a single-payer healthcare system which allows doctors to, or allows the government, I should say, to negotiate with both healthcare providers, doctors, hospitals, and drug companies in order to get lower prices for the taxpayer, for you guys. That's what we need, not more bullshit privatization. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.